This episode of Fertile Talks is sponsored by ILMeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ILMeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. Good evening, everyone. This is Dr. Famuyiwa, your host of Fertile Talks. And tonight we're going to be doing something different. We're going to be talking about oligoasthenospermia. So if you or your partner has seen a result on a semen analysis that has this diagnosis and you want to know more about it, this is the place to be. So tonight we're going to go into the different categories of it with the hope that by understanding it in depth, you'll be able to be more informed with choosing the appropriate treatment. So what is oligoasthenospermia? It actually comes in 3 stages. There is a level 1, a level 2, and a level 3 that has to do with the severity of it. Level 1 is characterized by some reduction in the sperm count, as well as the motility, the ability of the sperm to move. And I'm going to show you what that is in a second. So some of the sperm do retain adequate motility. They're not all bad. And the concentration is always good enough that natural conception may occur with this. It usually results from suboptimal testicular function, like the testis is not working as well as it should. That leads to slight reduction in the production of sperm. So you might have mild oxidative stress, and I'm going to go into what this is in a second and how it really impacts the sperm. The sperm is a very small cell. It doesn't have the capacity to repair itself. So any amount of oxidative stress can impair its function. Now with level 1 oligoasthenospermia, natural conception is still possible. It may take a little longer, but it's still possible, and sometimes just lifestyle changes may result in improvements. So how do you interpret this? Moderate reduction in sperm concentration and motility, but the morphology, the shape, is still within acceptable range. Now let's talk about stage 2. Stage 2 we characterize as moderate. This has a noticeable decrease in the sperm concentration and motility compared to what normal should be. And it decreases the chance that pregnancy will occur or conception will occur naturally, right? So the mechanisms for this includes excessive or more oxidative damage than in stage 1. And this results in fragmentation of the DNA in the sperm. It also results in decreased motility. Things such as hormonal imbalances can be involved. What is this? Things such as decreased testosterone or disrupted follicle stimulating hormones coming from the pituitary gland to the testes may hinder the production of proper sperm. So patients that have level 2 may need some assistance. You may need intrauterine insemination to help facilitate pregnancy. Let's talk about level 3. Level 3 is marked by low sperm count and very poor motility. And I'm going to show you some examples of some semen analysis, what they look like with each level. These patients, the ability to conceive naturally is usually highly unlikely because the damage is severe. And we're talking about severe oxidative damages that damages the sperm membrane. Liquid peroxidation is when one electron just knocks off on one atom and it just propagates itself, causing further damage down the line. And if you damage enough, the sperm cannot move the way it should. Sometimes you may have patients who have abnormalities, structural abnormalities, such as varicocele, may result in this. And sometimes having that surgically corrected may help. Other causes could be genetic, where you have micro deletions on the Y chromosome, and those deletions result in disruption of sperm production. Usually, assistance is needed with in vitro fertilization or intracytoplasmic sperm insemination, where you get one sperm, you hold one egg and you hold it down and you insert the sperm directly into it. And that usually helps with conception. How do you make this diagnosis? Well, the key diagnostic feature for that is the semen analysis. There are certain parameters that are looked at on the semen analysis. One is your sperm concentration. It looks at the number of sperm present in a given volume of semen. We also look at the motility, the percentage of sperm that can effectively move, called progressive, is important. There are some sperm that don't move well, or they move in a circular fashion, or they're just kind of shaking there. They're not going to be able to make the grade. Then the other part of the semen analysis includes the morphology, the shape, what does the head look like, the tail look like, and the vitality. Are they dead on arrival? Are they mobile? Are they alive? So this is an anatomy of what the sperm looks like. You have a sperm head that has a tip that has an acrosome. I'm going to try and show you using my... Yeah, that's the acrosome of this at the tip of the sperm that releases chemicals that aids in the sperm being able to penetrate the egg. Then you have the DNA, which is really almost the entire head of the sperm. It doesn't have a lot of cytoplasm. You have a midsection, and then you have a flagella, the tail, that is responsible for that movement that zips the sperm right along. Now, I'm going to show you a slide of what a moving sperm looks like. Let's see if I can get this slide to work. So healthy sperm would look like this under the microscope, and you can see them moving with a mission and purpose, zipping around. And these are, they look normal shaped sperm. In reality, no one has 100% normal shaped sperm. But this is what you would see under a microscope. Now, when we test the sperm, what are we talking about? If you look to your left here, or my left, the sperm count normally would look like something like this on a dish, whereas if you have a very low sperm count, you see very sparse number of sperm. The shape of the sperm, I showed you a picture of what a normal sperm should look like. Anything that doesn't look like that is abnormal. So in this case here, you see a sperm that has two tails, one that has a bent midsection, one that has two heads. And over here is a normal moving sperm, which I'm sorry you can't see it on here, is the tail on this sperm is severely bent and it really cannot move and function the way it should. Now, how do you make the diagnosis? You can make the other diagnostic features besides the semen analysis that you would, if someone comes back with an abnormal semen parameter, you want to check their FSH level. Are they even producing enough hormone from the pituitary gland, enough to stimulate growth of the sperm? Are they able to produce enough testosterone levels? What does the testis look like? Have they had a scrotal ultrasound? So you might be able to pick up structural problems like testicular masses or tumor. I know I have had patients who've had testicular tumor that were detected because we got scrotal ultrasound. Also, you want to look at genetic factors. So sometimes I'll have my patients go get peripheral chromosome smear, and then we look at we call it a Y chromosome deletion assay. Now let me show you a report of what a stage 1 oligoasthenospermia would look like. In this sample, the patient has a count of 12 million per ml, which is slightly low, right? Normal should be above 15 million per ml. The motility for this patient is just slightly low. Normal should be more than 40%. And the morphology is good. The patient has a normal morphology of 5%, strict morphology that is. Normal should be greater than 4. So mild abnormality, this will be a stage 1, right? Stage 2, now we're looking at this semen analysis in this gentleman here. The volume is good. Volume should be greater than 1.5. That volume is good. But look at the sperm count. We talked about the sperm count being 50 million or more. This gentleman has 7 million, and the percentage of sperm moving is only 25%. Remember, we said we wanted at least 40% moving. Now here, the morphology is a little bit low. Normal should be 4%, and the patient has only 3%. The pH is normal. pH should be, this pH is a normal pH for what it should be. So this will be a little bit more abnormal than the first one I showed you. Now let's look at severe oligoasthenospermia. This one shows a volume of 1.5 ml, but the sperm concentration is only 2 million per ml. Then you look at the total motility is low. Motility is only 10%. Progressive motility is only 5%. The morphology of the patient is only 1% normal form, and the pH is 7.3. Okay. So we look at genetic causes, chromosome abnormalities. We look at Klinefelter syndrome or Y chromosome microdeletion. So hormonal imbalances. One of them is hypogonadotropic hypogonadism or other disruptions in the hypothalamic pituitary gonadal. What are the causes of oligoasthenospermia? Some of the causes that include things such as infections. If people have had orchitis is an inflammation of the testes, such as mumps orchitis as a childhood infection, that can affect the testes. Trauma can also lead to problems or dysfunction, as well as what is called varicocele. Varicocele are dilated blood vessels around the testes that lead to heating up of the testicular environment and causing damage to the testes. There is a reason why the testicles are outside the body. Excess heat of the testes leads to damage. Environmental factors such as toxins, pesticides, heavy metals, or radiation can also lead to damage. Lifestyle factors such as smoking, excessive alcohol consumption, obesity, poor diet, and stress. Medications, certain drugs include chemotherapeutic agents, steroids and opioids can cause problems. Treatment options include, and how those treatment work, include lifestyle modifications, such as quitting smoking, reducing excess alcohol intake, improving diet, and exercising regularly. This leads to oxidative stress and reduces inflammation to help protect the sperm DNA and membranes and enhance overall hormonal balance to support sperm development. Another thing that is now rampant nowadays is the consumption of marijuana and medical marijuana and THC. There's been a lot of data now coming out in research coming out showing that this can cause oxidative stress and can lead to abnormal sperm parameters. Okay, so let's go to other treatments for. So, what are the treatment remedies available to gentlemen who have this? Usually, sometimes the reproductive urologist, and I do work in conjunction with a reproductive urologist, may prescribe clomiphene citrate, that is, and that works by blocking estrogen receptors at the hypothalamic level. This produces a feedback effect of having more FSH produced by the pituitary gland that can now hopefully try to stimulate the testes more to get more sperm production. Another way they sometimes treat this gentleman is to give them HCG or human chorionic gonadotropin, and that stimulates directly testosterone production in the testes. There are supplements that men may use, such as vitamin C, vitamin E. If you're taking vitamin E, at least 400 milligrams. CoQ10 is an antioxidant that reduces the oxidative species that are causing damage to the sperm. I also like to include vitamin B6 and B12. And the effect of this is to try to restore hormonal balance and protect sperm from oxidative damage to improve both the count and the motility. Some patients may actually require surgical intervention. For patients who have very dilated scrotal veins, surgical ligation of these veins may help to improve function. How does this work? The testicles are located outside the body for a reason. Heat in the central body core can damage sperm. So if the veins are dilated, they conduct that heat straight from the body down into the testes, and that can destroy testicular function. So by ligating those dilated veins, you prevent that extra abnormal blood flow and heat conduction to help to improve sperm development. Sometimes patients may have obstruction in their vas deferens or in their reproductive tract, and that can impede sperm transport. So having surgical removal of these blockages may be helpful. Now recall I said that some patients have such severe abnormalities that they need help. What are the things that you could do? Intrauterine insemination, IUI, is when the sperm is washed and placed directly into the uterus during ovulation. So this bypasses the cervical barriers and increases the concentration of motile sperm that are near the egg. Another treatment option is to proceed with in vitro fertilization to try to isolate the best possible sperm out of an ejaculate. And there are different ways to do this. One of the ways I like to use it is to use a fluidic device called the Zymot kit that helps to separate the abnormal from the normal sperm as much as possible. And then from this collection, you try to identify the single best possible sperm and inject that directly into the egg. So you overcome the severe motility and count issues by ensuring fertilization, even with poor quality semen parameters. So to conclude, oligoasthenospermia is really multifaceted. condition, and it has diverse causes and it has varying severity levels. So understanding the mechanism and implementing tailored interventions from lifestyle changes to advanced assisted reproductive technology can significantly improve fertility outcomes. But the key thing is early diagnosis and consultation with a fertility specialist, which is essential for optimizing your treatment options and achieving the best success. Once again, thank you for another exciting episode of Fertile Talks. I'm sure you may know someone who may benefit from this information. If you're watching this, you can also see the YouTube videos so you can see some of the slides I prepared. And please do not forget to like, share, and subscribe. And we thank all our supporters and I encourage you to go to our Buzzsprouts homepage and be a supporter to help us bring you more wonderful episodes. Thank you once again. This is Dr. Famuyiwa. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.